Delayed puberty or lack of development of secondary sexual characteristics in girls is a common problem affecting approximately 2.5% of all girls. Timely evaluation and management of girls with delayed puberty is absolutely important. The normal process of puberty involves the start of breast development typically around 10 to 11 years of age, with achievement of periods approximately 2 to 2.5 years from the onset of breast development. The absence of breast development by 13 years or absence of periods by 15 years is considered to be delayed puberty. Many parents come to us at a time when there is no need for evaluation because the girl is less than 13 years, and at this age sometimes the evaluation has been done, the hormonal profile will be abnormal, the ultrasound may be abnormal. So very important, do not get worried if your girl is not yet 13, there is enough time to grow. Only if the development is not happening till 13 years of age, though there is no period till around 15 years of age, you should get concerned. The regulation of puberty involves the combination of the hypothalamus, which is located in the brain, which secretes the GnRH, gonadotropin releasing hormone, which further produces the LH, the luteinizing hormone, and FSH, the follicle stimulating hormone from the pituitary. These hormones act on the ovaries to produce estradiol, which is responsible for all the secondary sexual development in the form of breast development, in the form of uterine growth and periods. Estrogen is not only involved in the pubertal development, it is also very important in the development of bones, in heart, brain, muscle and skin. So whenever we are talking about delayed puberty, we are not just talking about the physical appearance or the pubertal development. We are not only talking about the mental effects of that, we are also talking about the impact of less estrogen on these girls in terms of their long-term bone health, long-term muscle health, long-term cardiac health as well. Delayed puberty in girls could be either because of a delay onset of puberty, which is in a way we can say that the start has not happened but it will happen in time, which is known as constitutional delay of puberty in growth, or problems related to the hypothalamus or pituitary, which is a hypogonadotropic hypogonadism, or problems related to the ovaries in which the ovaries are either not working or they have got damaged. Approximately 30% of all girls who come to us with delayed puberty have what is known as a constitutional delay of puberty in growth. They tend to be shorter as compared to their other classmates. They also give often a history of delayed puberty in the father or the mother. So father may have had the onset of shaving later, he would have grown in the college years, or mother had a late onset of menarche. Most of these girls will have a spontaneous development of puberty, but this may take a long time. Girls who have problems in the brain because of any cause, which includes a number of infectious disorders, numbers of infiltrative disorders, number of immune disorders, and rarely problems which are associated with brain tumors, can have a damaging effect on the hypothalamus and pituitary, causing delayed puberty. Any disorder affecting any part of the body, be it a liver disease, a kidney disease, a heart disease, a respiratory disease, infection, absorption problems, celiac disease, would result in decreased weight of the child, result in decreased fat amount of the diet, and that will clearly result in what is known as delayed puberty. Any problem in the ovaries, right from the development of the ovary or the damage to the ovary because of infection, because of torsion, because of radiation, or because of many treatments, especially for cancer treatment, may have a bad effect in terms of ovary, and that will result in decreased production of hormones as well as decreased production of eggs. This group of disorders in which characteristically the ovary is at fault and the hypothalamus pituitary is working well is associated with a high level of follicle stimulating hormone, and this results in what is known as quote unquote premature ovarian insufficiency. Very important cause of delayed puberty in girls, particularly those who have got a high FSH level or a hypergonadotropic hypogonadism, is called as Turner syndrome, which is a chromosomal disorder in which one of the X chromosomes is either not present or is partly deleted. The key questions which we as doctors have to answer about a girl who comes to us with complaints of delayed puberty is it really delayed puberty? What is the cause? And what could we do in terms of improving those symptoms? A comprehensive clinical examination, we look from head to toe, look for features of delayed puberty, we look at growth as to how the height is going, how the weight is going, how the puberty is progressing, and specifically based upon that we do a complete clinical examination. A laboratory evaluation is integral to pubertal assessment, and this includes the exclusion of very common disorders like liver, kidney, thyroid, celiac disease, and other common disorders which we'll evaluate, followed by an hormonal evaluation. The key hormonal evaluation in a girl with delayed puberty include the gonadotropins, which are LH, FSH, and estrogen. Now, any girl who has delayed puberty is expected to have a low estrogen. In response to that, the pituitary should actually produce more amount of LH and FSH. So, in girls who have got low estrogen and high LH and FSH level, we know that the problem is predominantly in the ovaries. While in those girls in which LH or FSH levels are low or normal despite low estradiol, the problem is either in the hypothalamus or the pituitary or other systemic disorders. Once we have excluded the systemic disorders, girls with low LH and FSH and delayed puberty should have a MRI of the brain to identify any possible pathology. In girls who have got a high FSH level, the problem is predominantly in the ovaries. The very important consideration is Turner syndrome, for which a chromosomal analysis or karyotype is done. The aims of management of a girl with delayed puberty include the normal induction of puberty, correction of problems which are affecting the girl in terms of short height or mental issues, and long-term reproductive and fertility issues. The treatment is usually started only after the age of 13 years, and our aim is try to copy or mimic what the body does. So as a normal girl will start the development around 11 years of age, would have period by around 13 years of age, our aim again is to have a 2-year gap between the start of breast development to the periods. A very rapid development of these would result in a compromised height, compromised breast development, and compromised uterine size. So we should not push a very fast development in that regards, and this is something which is difficult to explain because parents often are very concerned, they're already late and they want us to push and start periods. What we need to understand is that periods is just one symptom. When we are treating a girl with delayed puberty, we are trying to correct her estrogen deficiency, we are trying to build up her bones, we are trying to build up her breast tissue, build up her uterine tissue, and then periods is an automated outcome of the entire process. So our aim is to start at a very low dose, typically around 10% of what we start in adults, and then gradually build up every 6 months to achieve periods by around 2 to 2.5 years. During this period, we very carefully monitor the girls with regards to their physical development, their height, their bone age, and uterine growth as well. Usually by 2 to 2.5 years, there may be a spontaneous bleeding which has happened, or the uterine size will show that the endometrial thickness has become significant. In that case, we start using the second hormone, the progesterone. Progesterone is produced via the specific part of the ovaries, the corpus luteum, in the secretory phase, and its major role is in terms of inducing periods. So once our uterus has grown, the endometrial thickness has grown, in that regards the progesterone is given with a particular aim to achieve shedding of the endometrium resulting in periods. Once the periods are achieved, we would then like to continue both estrogen and progesterone, because remember, our aim is not just periods, our aim is to correct the abnormalities because of estrogen deficiency. So usually we will be giving estrogen for around 21 days, and the last 10 days will be the progesterone. After we stop these medicines, typically after around 5 to 6 days, there will be periods, and then again from the 5th day of cycle, we start these preparations again. Estrogen is available both as oral as well as transdermal preparation. The transdermal, or the one which we can give over the skin using the skin patches or using this ointment, is more physiological, is better, causes less side effects, but it is expensive and not easily available. So most girls in India and other resource poor countries are still using the oral estrogen. In girls who have constitutional delay of puberty and growth, we may give a short trial of estrogen. These girls are delayed because of delayed bone maturation, and if we give them estrogen to push their growth, often we will be able to kickstart puberty, and this may be done for 3 to 6 months to achieve a good outcome. A major issue in terms of the overall concern of parents with regards to girls with delayed puberty is long-term fertility. And in disorders in which the problem is predominantly in the hypothalamus or the pituitary, there is deficiency of LH and FSH. If we give a appropriate ovulation induction using LH and FSH under careful monitoring by a reproductive medicine specialist, we would be able to achieve normal egg development and pregnancy. In girls who have delayed puberty because of ovarian problems, both the estrogen as well as egg development is defective. So in this scenario, it is not possible to induce egg development. The only option in terms of long-term fertility is with regards to giving a oocyte donation and using the in vitro fertilization technique, in which egg is taken from a donor, the egg and sperms are fertilized outside, and then the embryo is transferred into the mother. Delayed puberty therefore is a common presentation, a major cause of concern, and maybe the only sign of disease in a girl. और इसको आरंभ करने के पश्चात ब्लड प्रेशर को देखना भी अत्यधिक आवश्यक होता है.